Thank you for joining me for another episode of Mental Health Matters. Today, we're going to take a few minutes to discuss anxiety. But before we get started, let's discuss suicide prevention. As we all know, September is set aside as Suicide Prevention Month. And I believe it's important to take just a few minutes to discuss this important subject. Suicidal thoughts, it's much like a mental health conditions, and they can affect anyone regardless of age, gender, or background. Suicidal thoughts, they are often common, but they should not be considered normal, and they often indicate more serious issues. September is Suicide Prevention Month, where it's a time to raise awareness of this urgently important crisis. We use this month to shift public perception. We spread hope and share vital information to people affected by suicide. The goal is ensuring that individuals, friends, and families have access to the resources that they need to discuss suicide prevention and to seek help. According to the CDC, each year more than 41,000 individuals die by suicide, and they leave behind family and friends to navigate the tragedy of their loss. Suicide is the 10th leading cause of death among adults in the U.S., and it's the second leading cause of death among people between 10 and 24. And these rates are increasing. If you or someone you know is struggling or in crisis, help is available. In the U.S., call or text 988 or chat 998lifeline.org to reach the 988 Suicide and Lifeline crisis. Okay, let's get started talking about anxiety. Anxiety disorder, it's a mental health disorder, and it's characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Examples of anxiety disorders, they include panic attacks, obsessive compulsive disorder, and PTSD. Symptoms include stress that's out of proportion to the impact of the event. It's an inability to set aside a worry, and it's restlessness. Treatment includes counseling or medication, including antidepressants. Experiencing occasional anxiety, that's a normal part of life. However, people with anxiety disorders, they're worry and fear about everyday situations, and often that anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear. These feelings of anxiety and panic, they interfere with the person's daily activities. They're difficult to control and they're out of proportion to the actual danger, and they can last a long time. You may avoid places or situations to prevent these feelings. Symptoms may start during childhood or the early teen years and continue into adulthood. Examples of anxiety disorders, they include generalized anxiety disorders, social anxiety disorders, which is also referred to as social phobia, specific phobias, and separation anxiety disorder. You can have more than one anxiety disorder. Sometimes anxieties result from medical conditions that need treatment. Whatever form of anxiety you have, treatment can help. Common anxiety signs and symptoms include feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, hyperventilation, sweating and trembling, feeling weak or tired, trouble concentrating, or thinking about anything other than the present worry, having trouble sleeping, experiencing gastrointestinal problems, having difficult controlling worry, having the urge to avoid things that trigger anxiety. Several types of anxiety disorders exist. Agoraphobia is a type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. Anxiety disorder due to a medical condition includes symptoms of intense anxiety or panic that are directly caused by a physical health problem. Generalized anxiety disorder includes persistent and excessive anxiety and worry about activities or events, even ordinary routine issues. The worry is out of proportion to the actual circumstance, and it's difficult to control, and it affects how you feel physically. It often occurs along with other anxiety disorders or depression. Panic disorder. It involves repeated episodes of sudden feelings of intense anxiety, fear, or terror that reach a peak within minutes. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering or pounding heart. These panic attacks, they may tend to worry about them happening again or avoiding situations in which they've occurred. Selective mutism. It's a consistent failure of children to speak in certain situations, such as school, even when they can speak in other situations, such as at home with close family members. This can interfere with schoolwork and social functioning. Separation anxiety. It's a childhood disorder characterized by anxiety that's excessive for the child's developmental level and related to separation from parents or others who have parental duties to this child. Social anxiety disorder, or also known as social phobia, involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Specific phobias are characterized by major anxiety when you're exposed to a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people. Substance-induced anxiety disorder is characterized by symptoms of intense anxiety or panic that are a direct result of misusing drugs, taking medications, being exposed to a toxic substance, or withdrawal from drugs. Other specified anxiety disorder and unspecified anxiety disorder are terms for anxiety or phobias that don't meet the exact criteria for any other significant enough to be distressing and disruptive. See your doctor if you feel like you're worrying too much and it's interfering with your work, your relationships, or other parts of your life. Your fear, worry, or anxiety is upsetting to you and difficult to control. You feel depressed, have trouble with alcohol or drug use, or have mental health concerns along with anxiety. You think your anxiety could be linked to a physical problem, or if you have suicidal thoughts or behaviors. If this is the issue, seek emergency treatment immediately. Your worries may not go away on their own, and they may get worse over time. If you don't seek help, see your doctor or a mental health provider before your anxiety gets worse. It's easier to treat it if you get help early. The causes of anxiety disorders aren't fully understood. Life experiences such as traumatic events appear to trigger anxiety disorders in people who are already prone to anxiety. Inherited traits can also be a factor. For some people, anxiety may be linked to an underlying health issue. In some cases, anxiety signs and symptoms are the first indications of a mental illness. If your doctor suspects your anxiety may have a medical cause, he or she may order tests to look for signs of a problem. Examples of medical problems that can be linked to anxiety include heart disease, diabetes, thyroid problems such as hyperthyroidism, respiratory disorders such as chronic obstructive pulmonary disease, and asthma, drug misuse or withdrawal, withdrawal from alcohol, anti-anxiety medication or other medications, chronic pain or irritable bowel syndrome, rare tumors that reduce certain fight or flight hormones. Sometimes anxiety, it can be a side effect of certain medications. It's possible that your anxiety may be due to an underlying medical condition. If you don't have any blood relatives, such as a parent or sibling with anxiety disorder, and you didn't have an anxiety disorder as a child, you don't avoid certain things or situations because of anxiety. You have a certain occurrence of an anxiety that seems unrelated to life events, and you didn't have a previous history of anxiety. Some of the risks that may increase your risk of developing an anxiety disorder are trauma or witnessing a traumatic event. Then you're at higher risk of developing an anxiety disorder at some point in your life. Adults who experience a traumatic event, they can develop anxiety disorders. Stress due to health conditions or serious illness can cause significant worry about issues such as your treatment and your future. Stress buildup is a big event or a buildup of smaller stressful life situations may trigger excessive anxiety. For example, a death in the family, work stress, or ongoing worry about finances. People with certain personality traits, they are more prone to anxiety disorder than others are. And people with other mental health disorders, such as depression, also often have an anxiety disorder. Anxiety disorders can run in families. Drug or alcohol use or misuse or withdrawal that can cause or worsen anxiety. Have an anxiety disorder, it does more than make you worry. It can also lead to or worsen other mental and physical conditions, such as depression, which often occurs when an anxiety disorder, or other mental health disorders, substance misuse, trouble sleeping, digestive or bowel problems, headaches and chronic pain, social isolation, problems functioning at school or work, a poor quality of life, suicide. There is no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of symptoms. If you're anxious, get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. Stay active. Participate in activities that you enjoy and that make you feel good about yourself. Enjoy social interactions and caring relationships. These can lessen your worries. Alcohol and drug use can cause or worsen anxieties. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find a support group to help you. You may start by seeing your primary care physician in order to find out if your anxiety could be related to your physical health. And he or she can check for signs of an underlying medical condition that may need treatment. However, you may need to see a mental health specialist. If you have severe anxiety, a physician, which is a medical doctor who specializes in diagnosis and treating mental health conditions, may need who you see, such as a psychiatrist. A psychologist is a certain other mental health professional, and they can diagnose your anxiety and they can provide counseling. A psychological evaluation, it involves discussing your thoughts, feelings, and behavior to help pinpoint a diagnosis and check for related complications. Anxiety disorders often occur along with other mental health problems, such as depression or substance misuse, which can make diagnosis more challenging. Many doctors use the criteria in the Diagnostic and Statistical Criteria, a manual of mental disorders, to diagnose an anxiety disorder. The two main treatments for anxiety disorders are psychotherapy, which is counseling, and medications. You may benefit from a combination of the two. It may take some trial and error to discover which treatments work best. Psychotherapy, also known as talk therapy or psychological counseling. Psychotherapy works with the therapist to reduce your anxiety symptoms, and it can be an effective treatment for anxiety. Cognitive behavioral therapy is the most effective form of psychotherapy for anxiety disorders. Generally, short-term treatment, or CPT, focuses on teaching you specific skills to improve your symptoms and gradually return to the activities you've avoided because of anxiety. CBT includes exposure therapy, in which you gradually encounter the object or situation that triggers your anxiety, so you can build confidence that you can manage the situation and anxiety symptoms. Several types of medications are used to help relieve symptoms depending on the type of anxiety disorder that you have and whether you also have other mental or physical issues. For example, certain antidepressants are used to treat anxiety disorders. An anti-anxiety medication called buspirone can be prescribed in limited circumstances. Your doctor may just prescribe other types of medication, such as sedatives. These medications are for short-term relief of anxiety symptoms and not intended to be used long-term. While most people with anxiety disorders need psychotherapy or medications to get anxiety under control, lifestyle changes also can make a difference. Here's what you can do. Develop a routine that you're physically active most days of the week. Exercise is a powerful stress reducer. It may improve your mood and help you stay healthy. Start out slowly and gradually increase the amount and intensity of your activities. Avoid alcohol and recreational drugs. These substances can cause or worsen anxiety. If you can't quit on your own, see your doctor or find a support group to help you. Quit smoking and cut back or quit drinking caffeinated beverages. Both nicotine and caffeine can worsen anxiety. Use stress management and relaxation techniques, visualization techniques, meditation, and yoga are examples of relaxation techniques that can ease anxiety. Make sleep a priority. Do what you can to make sure you're getting enough sleep to feel rested. If you aren't sleeping well, see your doctor. Some herbal remedies have been studied as a treatment for anxiety, but more research is needed to understand the risks and benefits. Before taking herbal remedies or dietary supplements, talk to your doctor to make sure they're safe for you and won't interact with any medications you take. To cope with an anxiety disorder, here's what you can do. Learn about your disorder. Talk to your doctor or mental health professional. Find out what might be causing your specific condition and what treatments might be best for you. Involve your family and friends. Ask for their support. Stick to your treatment plan. Take medication as directed. Keep therapy appointments and complete any assignments your therapist may give you. Consistency can make a big difference, especially when it comes to taking your medication. Learn what triggers your anxiety or causes you stress. Practice the strategy you developed working with your mental health provider so you're ready to deal with anxious feelings in these situations. Keep a journal. Keeping track of your personal life can help you and your mental health provider identify what's causing you stress and what seems to help you feel better. Join an anxiety support group. Remember that you aren't alone. Support groups offers compassion, understanding, and shared experiences. Learn time management techniques. You can reduce anxiety by learning how to carefully manage your time and energy. Socialize. Don't let worries isolate you from loved ones or activities. Break the cycle. When you feel anxious, take a brisk walk or delve into a hobby to refocus your mind away from your worries. Many tricks and tips can help calm your anxiety. Therapy use visualization techniques, which involves mentally visualizing peaceful scenes to promote a state of relaxation. Practice diaphragmatic breathing. It is a type of deep breathing technique that often reduces cortisol levels in healthy adults. Avoid procrastination. People with anxiety may be prone to putting off important tasks or projects to temporarily avoid stress. However, procrastination often results in a last minute rush to complete tasks before a deadline. This causes even greater stress and anxiety. Limit the alcohol intake. Research suggests there are links between alcohol use and anxiety, as they often occur together. They may involve similar brain structures without treatment. Both alcohol use and anxiety can have severe long-term effects. Also, constant access to a phone can increase a person's stress levels. Uh, According to the Anxiety and Depression Association of America, people can help themselves by accepting that there are some things they cannot control. Doing their best rather than aiming for perfection, learning what triggers their anxiety, limiting their caffeine and alcohol use, trying only to eat well-balanced meals, trying to get plenty of sleep, getting some exercise every day. If people are feeling overwhelmed with financial or administrative problems, it may help to take time to make a plan. Set targets and priorities and check them off once done. A plan may also help people say no to additional requests from others that make them feel anxious. If you are having feelings of serious or severe anxiousness, talk to your doctor immediately. Stigma around mental illness, it's been recorded in history since the beginning. People will progress in many areas of stigma. We have made progress, but prejudice can remain. And the only way to change these is by talking about it. Attitudes haven't changed in mental health since the 1950s. There's that shame, the stigma of shame. And it's changed only when people decide to talk about it. So do not be afraid to talk to family, friends, and others about what you're feeling and what you're going through. That is the only way we can stop the stigma of mental health. Please, if you are having any of these symptoms, it is important to get help immediately. And I want to thank you again for joining me for another episode.